Has there ever been a time when diabetes was more in the news? Hello, I'm Nick Haynes. As America fights to combat the spread of the coronavirus, there's heightened attention on those being hardest hit. Americans with pre-existing conditions. And who's being listed among the most at risk?
Diabetes.
I'm pre-diabetic.
Hanks has diabetes.
KCPT recently joined with PBS in bringing you a major new documentary series that examines this often ignored yet deadly disease. It's called Blood Sugar Rising.
Half of the U.S. population will have either diabetes or pre-diabetes by the year 2025.
Now we're examining how it's impacting us closer to home. We're answering your questions with some of our Metro's leading providers.
It's a very sneaky disease.
Healthcare advocates.
What we eat is a strong predictor of our health outcomes.
And patients.
I've had diabetes for around 9 years.
Not only are you over 60, you have diabetes as well.
Yeah, you don't have to put my age out there like that.
Support for critical health issues on KCPT is made possible by the generous support of the Health Forward Foundation and from viewers like you. Thank you.
Checking in with us is one of our Metro's most prominent experts on diabetes, Dr. Betty Dries, an endocrinologist with the UMKC School of Medicine and head of the graduate school at the Stowers Institute for Medical Research. Kiana Thomason leads Health Forward, Kansas City's largest healthcare foundation, and as there is nothing worse than doing a program about an issue and not including those most affected. Also with us, 17-year-old Sarah Golder, who lives with type 1 diabetes, and longtime public health leader Jim Nunnally, who lives with type 2 diabetes. He now hosts a weekly radio show on KRPT all about the issues of diabetes called Plain Talk. Betty Dries, you know, we have The View. We're seeing all of these headlines about people contracting the virus. Are people who are diabetic more likely to get coronavirus, or are they more likely to have a worse outcome if they get it?
That's a very good question. You know, we're still new enough in this. We're continuing to learn about effects of the COVID-19. What it looks like right now is people with diabetes are not more likely to catch the coronavirus, but if they do catch it, they're more likely to have a severe outcome.
Can you pause for a moment and just give us a quick explainer? Because we do know there are two types of diabetes. What is the difference?
The difference is that type 1 diabetes is an absolute lack of insulin. Most often comes on in younger age groups, and they absolutely have to have insulin. Type 2 diabetes, on the other hand, is a little different in that people don't make enough insulin to overcome their body's resistance, but they're not absolutely life dependent on it like the people who have type 1.
And you are type 1, Sarah. Most of us may not know what it feels like to have diabetes. What physical changes do you go through, perhaps, that your friends do not?
The amount of times that I have to be aware of everything, kind of either what's around me, if it's like a certain amount of food that's there, like a party or something, or just like the amount if I'm working out with my friends, making sure that my blood sugar is on track and stuff like that.
Now, you don't have to worry about parties right now. You're not working out in a gym because you can't do any of those things. Are you doing the same things as everybody else is doing right now, or are you taking extra precautions?
At least my family in my house are taking a little bit extra precautions. Or if we order something from Amazon or like online packages, we make sure to like doubly wipe everything down, especially like groceries or something.
Does diabetes impact certain racial groups more than others, Kiana Thomason?
We do see higher diabetes prevalence in many communities of low socioeconomic status and many communities of color. A lot of that is attributed to their underlying risk factors, demographic, socioeconomic, as well as their access to healthy, whole, and life-giving foods. Above most anything else, food and what we eat is a strong predictor of our health outcomes. And one's economic circumstance plays a huge role in that. In Kansas City, or at least in our bi-state area, in Missouri, in 1 month alone, we've seen 328,000 new cases of unemployment. In Kansas, we've seen 158,000 new cases of unemployment in just 1 month. And so when you think about where families are going to cut corners, food is where it's likely going to be. And so that means we'll begin to see, if it wasn't already the case, more high fat, high sugar, overly processed, what I call fake foods. And so I think when we think about the current conditions of COVID-19, it certainly places diabetics at significant risk in food consumption.
We talk about the junk food, and we got lots of viewer questions and comments because we were going to do a town hall, if you remember, in person. This is our alternative at this moment in time, but we got lots of questions at that time. Alan, one of our viewers in Kansas City, Missouri, Jim, said a lot of type 2 diabetes is caused by sofas and 2-liter sodas. Now, that's a crude way of putting it, but can you prevent diabetes simply by changing what you eat, by exercising more?
I think I am the embodiment of that. In fact, the reason I wore this suit today is because this is a suit that I bought 10 years ago and it still fits, which indicates that I have been very tied to the premise that you are what you eat. And what I want to be is a healthy person. But let me show you how that manifests itself. I eat off of a smaller plate now. Now, as much as we get lost in all of the jargon that goes along with diabetes, sometimes the simplicity is standing right before you. So if you eat less, you'll do better.
David in Grain Valley also reached out to us, and he says the real danger to diabetics is the overpriced insulin. It's total BS. How much does insulin cost right now, and is it covered by health insurance, Dr. Dries?
Insulin costs could be anywhere from $500 a month up to a couple $1,000s a month, depending on how much insulin that you take. Most insurance plans should cover that. If you have no insurance coverage for insulin, it could be anywhere from $3,000-$5,000 a year up to $25,000, $30,000 a year.
What happens to those people who don't simply have the money for the medication?
Well, that's a big problem, and studies show that 25% of people ration their insulin. And fortunately, in response to the COVID-19, some of the pharmaceutical companies have special programs to cap the cost, the out-of-pocket cost, to as low as $25, $35 a month.
We began to see from a healthcare ecosystem utilization of emergency department use skyrocket as well. And there's just a domino effect from there on. And so not only does that person's individual health worsen, but the overall cost to our healthcare system increases as well.
You know, I just saw a story about people now going to Craigslist, seeing that listed on Craigslist that you can now purchase discount insulin. Is it become so expensive that people are now resorting to that, Jim?
I tell you, I have always said that I'm not afraid of diabetes. I'm afraid of the predators that prey on the people who have diabetes, and they die not necessarily of the diabetes, but of not having been able to get the right medications in the first place because of the predators.
The national PBS documentary series we've been running has been called Blood Sugar Rising. Does sugar cause diabetes, Dr. Dries?
Clearly, diet has an influence on development of diabetes, particularly type 2 diabetes and increased weight gain. And diets high in sugar are particularly detrimental to people in terms of weight gain. It's predominantly the weight gain, and it's not just sugar, it's also processed foods, highly processed foods. Very different story with type 2 diabetes versus type 1 diabetes.
Sarah, some people have the view that if you are diabetic, you can't be eating candy and you can't be eating cakes and pies. Can you have your cake and eat it too?
I've had diabetes for around 9 years, and I think growing up with it as like a kid, especially like Halloween time, was really hard. But I just made sure, and my mom held me with this, with like figuring out what I could eat and what I couldn't eat. Most of what I could ended up eating was like chocolate or something that had a little bit of protein or milk in it that could kind of balance out the sugar.
Sarah, what has been the dumbest question you've had to answer about your diabetes?
There have been a lot over the years. Randomly in like elementary school in the hallway, if someone knew I had diabetes, they'd be like, does that mean like if I eat a bunch of candy, I'm gonna get it? And I'm like, and I had to explain a lot to them.
Diabetics 4 times as likely to have a heart attack or stroke, we hear from the program, 8 times as likely to lose their eyesight, and according to the CDC, the leading cause of lower limb amputations in the United States. What is it about diabetes that causes that, Dr. Dries?
High blood sugars have an effect on tissues, and that has a long-term effect on kidneys and eyes and nerves that increase the risk of those complications.
I come from a rough background. Back in those days, we run out of food. We was eating syrup sandwiches, sugar sandwiches, where you just take the syrup and put it on the bread. And drunk Hawaiian Punch, Capri Suns, all that type of stuff. I'm a junk food addict. I eat candy, all type of sweets. It's been a real battle and a real struggle to where now I'm at this point.
Montiel Lee, at really the prime of his life, at the age of 36, almost 37, he's facing a really big challenge, which is he going to lose his foot?
One of my cousins rushed me to the hospital and they checked my levels and they was looking at me like, how are you even standing here on your feet? You're supposed to be in a coma.
Right.
I thought I was about to die. That's what they told me, that I had diabetes. And at that moment, my life changed. Mm-hmm.
Can we look at your foot?
Yeah.
Is that be all right?
Mm-hmm. I got an infection on the top of my toe.
Just out of nowhere?
Yeah.
Yeah, I can see that. But they said you might lose the toe. Okay, but I'm going to tell you, you don't want to put any weight on it.
Yeah, I'm fighting it.
Okay, my friend.
Appreciate you.
You too. Good luck.
Thanks a lot. I used to think only old people got diabetes. So now waking up every day, having to check blood and make sure these levels are correct and all this different stuff. I'm trying my best here. Yeah, the more I do this, I'm getting better. I watch the doctors do this, so now I'm trying to be just as good as them. Wrapping it. Mission complete.
Jim Nunnally, what can we do right now when it comes to the coronavirus, when everything is shut down? And if you are diabetic, I'm assuming you can't go to the doctor's office right now, and we can't be telling people, hey, if you think you might have diabetes, you should get screened. I'm assuming they're not doing that right now.
They are not. We are really in a horrible situation now that it points out the fact what we already knew was there in the first place. We are pouring gasoline on an already existing fire. But we kind of welcome the fact that it is finally being discussed, that it is the combination of things that kills us faster, more than just this coronavirus.
Michael in Mission, Kansas asks, what are the symptoms of diabetes? How do you know if I'm diabetic?
The symptoms of high blood sugar are that you're very thirsty, you have to urinate a lot, maybe get up at night to urinate, fatigue, maybe sores that don't heal well. Those are the classic signs. Unfortunately, with diabetes, particularly type 2 diabetes, you can have high blood sugars for a long period of time and have absolutely no symptoms, and yet it can be causing damage to nerves and kidneys and eyes. So it's a very sneaky disease.
Troy in Stillwell asks, my 58-year-old father was recently diagnosed with diabetes and he was placed on insulin to control it. I've been told that once on insulin, most diabetics are never able to live without it, that controlling their diabetes through nutritional and lifestyle changes alone is no longer an option. Is this correct?
No, I have been with diabetes 7.5 years, and I have yet to reach the insulin stage. I say that because I have kept my ranges well within the normal limits, but it has been mainly by diet control and exercise.
Rebecca says, how can I prevent diabetes? I am 14 and overweight, and diabetes runs in my family.
We have very good evidence that lifestyle change prevents development of type 2 diabetes, and this would include both in younger people as well as older people. And that means weight loss and exercise and healthy eating. And fortunately, you never get to a point that it's too late to change lifestyle to have an impact and be effective.
And I'm a living witness to that.
And there's some medications that are used too.
Yes. Kiana.
Yeah, I don't want to detract from the diabetes conversation, but it's a condition that affects your immune system. I also have a condition that affects my immune system. And just by the dietary changes that I've made, grain-free, pescatarian, low sugar, I have significantly decreased the inflammation in my body, which is the same for someone who has diabetes type 2. There are longitudinal studies out there that show that vegetarian diets that are very nutrient dense, not to say that medication's not important, because it is, but changing your lifestyle and your diet can go a long way to improve your health outcomes, even with diabetes type 2.
Is there an emotional side to this too, Sarah? Do you get treated differently by others once they know you have diabetes, or is it so common today and people know enough about it that it's a non-issue?
A couple years ago, it was a lot. I got treated a lot differently than I do today when people find out about that I have type 1. I think now there's a lot more education out in the world that people know about diabetes, that they're less kind of afraid of it. Or worried that, like, if a coach of mine when I was playing a sport was in charge of me, they'd be worried that they didn't know how to plan it or how to handle me. But now, like, if I have a coach that is coaching me in a sport, they're a lot more easygoing with it.
Alyssa says, the day before the stay-at-home order, I was diagnosed with type 2 diabetes, and I'm overwhelmed. Where do I begin, Dr. Dries?
There are a lot of resources that are online. The American Diabetes Association has a wonderful website with resources for people living with diabetes. The JDRF Foundation has wonderful resources, and they have a call number. You can get individual advice. Unfortunately, with the coronavirus, we have some limitations on things people can do in terms of group education, which everyone diagnosed with diabetes should get self-management education from a professional diabetes educator.
Knowledge is power. So now you can tell all your family this too. So in one 20-ounce bottle of Mountain Dew, there are more than 18 teaspoons of sugar. That's what it looks like. When you're drinking a bottle of Mountain Dew, you're drinking that much sugar. Mm-hmm. Isn't that crazy?
Yeah.
And all pop is about the same. Carbs in 1 cup of pineapple.
22 grams of total carbohydrate in 1 cup chunks.
Okay. Carbs in bananas. One of the things that we do in our diabetes education is we show patients how to read food labels. So 1 serving size is half a cup, and there are 4 grams of carbohydrates in half a cup. So that's a good choice. Yeah. That gives them power over what they're eating when they can make the choice. Do I put it in the cart or do I put it back on the shelf? Here's one of the best things you can eat, the plums.
Okay, that's
because 1 plum only has 8 grams of carbohydrates in the whole thing.
I found out how much I didn't know about diabetes.
I didn't understand about counting the carbs. Watch your sweets, watch the sugar intake, your fried foods. That all affects your diet.
Of those 3 types, which one's the best?
This one.
There you go.
We're learning, I should say, to eat differently.
They soak all of these fruits in sugar. Oh my goodness, I can't even believe that you picked that up. That is evil.
We don't even want to talk about them.
Where to now? One of my biggest pet peeves is with our labeling in the United States. If it says sugar-free, my patients pull that off of the shelf, put it in their cart, and think, I can have 8 or 12 of these cookies because they're sugar-free. They're not sugar-free. It's not true. A serving size is 4 cookies, and in those 4 cookies, there are 21 grams of carbohydrates. And it does have the sugar alcohol. It has sorbitol in it. They're sugar-free in huge letters. The game is rigged. Our labeling is done in such a way that it's almost a lose-lose situation, because people think that they're doing so well, but they're really not.
Dr. Dries?
You spend less than 1% of your life in the doctor's office and the rest of the time managing your diabetes yourself. You really need the tools to be able to do that. A lot of resources available online.
And we're going to put all of those resources you listed and others on our website at kcpt.org/diabetes. Brad in Prairie Village asks, is it possible to stop being diabetic?
It is not possible for someone with type 1 diabetes to stop having diabetes. They need insulin. Type 2 diabetes with lifestyle modification, we might could get them to a point of not needing medications for the diabetes specifically, but they're still going to need to have ongoing care the rest of their life and make sure they're not at risk for heart disease and other complications. I do want to say there's active research for cure of type 1 diabetes, and that is our great hope, is we will be able to reverse and cure type 1 diabetes.
That was the question from Sarah in Independence. What is the likelihood of a cure for diabetes? How far off do you think that is, Dr. Dries?
Hard to say. There are a lot of avenues of research for cure of type 1 diabetes, and we certainly hope that we see it sometime in all of our lifetimes.
And Sarah, I saw you shaking your head during that period of time, so that's what you're looking for.
Yeah, I hope so. I sure hope so, at least. With all the technology advancements that we've had so far, it's made it 100 times easier to manage diabetes, but a cure would be amazing too.
Gina in Overland Park has been watching the news, and she saw the Surgeon General of the United States, Jerome Adams, who seems to be on every single night on all of the news networks, and he says, he discloses he's at particular risk for the coronavirus because he has pre-diabetes. That's not something we've talked about much here. What on earth does that mean? Are you diabetic or you're not?
Prediabetes is a high blood sugar, higher than normal, but not high enough to be diagnosed with diabetes. And the people who have prediabetes generally do not have symptoms of high blood sugar because their blood sugars are not as high as with diabetes. But we know that they have increased risk for heart disease. And so we have a huge push for diagnosing prediabetes now to do the heart intervention and the kidney intervention because they are at risk, they are at higher risk of those conditions, and we need to intervene much earlier with lifestyle.
If you don't have the symptoms, then how do you know you are pre-diabetes?
There are risk tests that you can take, and you can take it off of the CDC website, cdc.gov, and you can also take it off of the American Diabetes Association website, diabetes.org. But basically, and these are for people at risk for type 2 diabetes or prediabetes, it's age, it's first-degree family relative who had diabetes, it's people who are of racial and ethnic minorities, women who've had gestational diabetes, people who are overweight and sedentary.
There are tons of other questions I have, but if there's one piece of advice or tip you would leave our viewers, what would it be, Dr. Drees?
In this time of coronavirus, make sure that you have a sick day plan, that you have all the supplies that you need, and you know what to do if you get sick, and you have a supply of your medications.
Sarah.
I would just say be patient. If you are just being diagnosed with diabetes, changes are going to take a while, I think, and to be patient with it.
Kiana Thomason.
I would underscore the element of food in all of this and remind folks that food truly is medicine.
Jim.
You should listen to our radio program every week.
Which is Mondays?
Mondays at 1 p.m. and it's called Plain Talk About Diabetes. And I don't know of anybody who wants to be amputated or blind or other complications with this diabetes.
Kiana Thomason, Dr. Betty Drees, Sarah Golder, and Jim Nunnally, thanks for Zooming with us on KCPT. By the way, we've pulled together all of the resources, the help numbers and tips you've heard during this conversation on our website, so you don't have to scramble to remember. It's kcpt.org/diabetes, kcpt.org/diabetes. I'm Nick Haynes. Thanks for caring about this too often ignored and overlooked disease, diabetes.
Support for critical health issues on KCPT is made possible by the generous support of the Health Forward Foundation and from viewers like you. Thank you.
Like you, our routines have changed, but what hasn't changed is our commitment to bringing you news, music, and entertaining programming. We're here for you when you need us on TV, on the radio, and online with Flatland. Currently, you are connecting to our services in record numbers. Thank you for your trust and your support. It's because of you we're able to provide the highest level of public service media, no matter what life may throw our way. Stay safe and stay connected.